Hi, this is Dr. Derek Mahoney. I'm a specialist orthodontist in Sydney. I want to talk to you as a potential patient on when you may benefit from what we know as orthodontic surgery or jaw surgery. So many times we'll have a patient who has a very severe jaw discrepancy, which we know as a class 3, which is a big lower jaw. And in the past, with big lower jaws, the treatment was always to push them back. We now realize that that could compromise the patient's airway, so we've come up with newer techniques which involve widening the top jaw and bringing it forward, which gives better facial balance and also helps to improve the airway. I'm very lucky to work with a talented maxillofacial surgeon. Let me explain to you what that is. That's someone who is dual qualified with a medical degree and a dental degree, and then the further training in jaw surgery. So Dr. David Lycrum is one of the few MaxFax surgeons in Australia that does a technique known as surgery first. What that means is when a patient comes in with a jaw abnormality, and it may be asymmetry, it may be a small lower jaw, a big lower jaw, he is able to work with me to produce a 3D imaging from a CT X-ray that allows us to work out which jaw is at fault and how we can move that into the right position. And then with that imaging, we can present to the patient a proposed outcome. Dr. Lycrum has appeared on Channel 9 News with his award-winning surgery breakthrough techniques, which he has learned overseas. And I've been treating patients with him for many years with outstanding results. So if you feel you have a jaw discrepancy that would need more than just the movement of the teeth, please come to our joint clinic where Dr. Lycrum and I will consult you together with the benefit of the records.
Not a lot of pain or discomfort?
None at all.
Sydney teacher Tara Flannery had her entire top jaw removed to cure her cancer. It's hard to believe this is her new reconstructed jaw.
Get blown away when I think about it.
Tara's a rock star, I think you would hardly know she's had such incredibly destructive surgery.
A 3D model was taken of Tara's jaw to help plan the removal and reconstruction.
It means that what we plan on the computer can then be executed at surgery. And for something as complicated as a jaw, it's absolutely critical.
The reconstruction was driven by the position of her original teeth marked in blue. 6 weeks before the actual surgery, they placed titanium implants and skin grafts inside her calf bone. 3 segments of that bone and nearby blood vessels would eventually be removed to build her new jaw.
It wasn't just replacing the jaw, there was muscles removed from my leg, put in to replace the top of my mouth, to replace my palate, and skin grafts that are now my gum.
Specialist dentists created acrylic teeth. Her new jaw fixed into place using plates and screws.
Ecstatic. More than happy.
Within the last few years, where we've been able to really automate this process, speed up this process, and really make it part of our routine care delivery for these patients.
Head and neck surgeons here are seeing more younger women being diagnosed with mouth cancers. It's a disturbing trend they're currently investigating. The cases are not linked to usual risk factors.
These mouth cancers historically occur in older men, particularly smokers and drinkers. We are commonly seeing women between the ages of 20 to 40 presenting to our clinics pretty well on a weekly basis with this kind of disease.
But Tara symbolises hope for those diagnosed.
We're living our best life now.
The software we use, after we take some scans of your teeth and some photos of your face, we also have what's called CBCT imaging. Low radiation, giving us a view of your entire jaw structure. Then we put it all together with this magical software. This allows me to look at the center line and the symmetry of your face, I can move the face in 3D, and my surgeon and myself can look at that and make a call as to which jaw is out of position. We can also then show you a proposal of what we would like to do, so that you get an idea of what's involved. And this software shows me soft tissue superimposed over hard tissue. So people are very interested in their profile, and this is one way that we can show them what part of their profile relates to the position of their teeth and the size and shape of their jaws. So when you come and visit the team at Full Face Orthodontics, you'll meet myself as the orthodontist for the initial orthodontic consultation. Let's say I'm like the architect in the deal. And then we have Dr. David Lycrum, who's like the structural engineer / builder, who'll be moving the jaws. But we move the jaws with a very sophisticated planning system so that everyone knows what to expect and has an idea of what the end result will be.